I'm going to welcome our next three speakers from the ministry, and we have John Reed, who after working in various roles in the hospitality, financial services, and manufacturing sectors, John joined the Ministry of Labour Training and Skills Development in 2004 as an industrial inspector working in North Bay. Since that time, John has been a regional program coordinator for the industrial program, a district manager, and in January 2021 became a senior manager of the cross-program strategy and support unit, which they're going to tell us a bit more about. And Ileana Raitt is the current vulnerable worker specialist at the ministry. She's a licensed lawyer with the Law Society of Ontario and has a vast experience interpreting legislation and advocating for marginalized groups. She came to the branch from the Office of the Worker Advisor, where she represented injured and vulnerable workers before the WSIB and the WSIAT Appeals Tribunal. She was previously employed at the WSIAT, where she was a part of the Tribunal Counsel Office and Parkdale Community Legal Aid Clinic Immigration Division, where she assisted clients in obtaining legal status. She has worked with underrepresented groups in her time at the Toronto West Detention Centre, YWCA, United Way, and UNHCR, and saw firsthand the barriers these individuals face, specifically regarding working conditions and occupational health and safety. She also formally acted as in-house counsel at GM, where she provided legal analysis and attended to all WSIB matters. She's passionate about alleviating workplace vulnerabilities and has a long history of working within the social justice legal system. So, and then they're going to be joined by Bill Roy at the end, who supplied his smiley face as his bio, and he is the director of the Strategy and Integration branch, which is the prevention arm of the ministry, and we'll talk about the prevention branch and how these recommendations are kind of internalized, and then potentially how we can drive prevention from what we learn from death investigation. So over to you, John.
Thanks very much, Val, and very happy to be here on this day to share information, create discussion, and help to hopefully prevent future deaths. The first thing I'd like to do is talk a little bit about the unit that I represent. Over the last couple of years, the Ministry of Labour has become an awful lot bigger. In essence, we've become the Ministry of Work. So we have had sections of other ministries or other small ministries moved over into our ministry. So the Ministry of Training, Colleges and Universities, as far as their apprenticeship division, has come over. Once again, that's tied to work. Settlement services. We've also had the Ontario Immigrant Nominee Program, and we've had the skills trades legislation come back to us as of this January. So these changes have taken place over the last couple of years. And because our ministry got so big, obviously our name has changed from Ministry of Labour to Ministry of Labour Training and Skills Development. We had to take a look at how we were set up to deal with all these new divisions coming on board. So we had an integration secretariat take a look at our ministry, the good, the bad, and how we can plan to go forward. And it was determined that within the operations division, which is where the cross-program strategy and support unit resides, that we needed a unit that could go across programs and go across divisions. And in essence, we build bridges between the enforcement programs, between the divisions such as prevention, and we try to move the needle so that we can fulfill the mandate of the prevention strategy. So the cross-program strategy and support unit was created a little over a year ago. And the important thing to note here, the vulnerable worker specialist used to reside with an individual program. And the vulnerable worker specialist was moved into the cross strategy and support unit along with the small business specialist. And there's several other specialists that I won't be talking about. But really, our mandate is to apply a lens of vulnerability to all the work that the ministry does. So positioned in a unit that is mobile and can move across divisions will definitely help us with doing that. The other thing I will mention, during the pandemic, there obviously, some of the comments talking about increased inspections. One of the things our ministry did, and it was sort of unprecedented in government during the pandemic, we had permission and we actually hired 100 new inspectors because we realized, our inspectors were working 12-hour days and on weekends when they could because of the amount of calls that we were getting. And we just had to increase the amount of people we had to provide service. So that was definitely challenging, but it's something that we did during the course of the pandemic. I'm going to talk about some of the definitions, and based on the conversation here, I think what I wanted to talk about is I represent the operations division, so that's enforcement. We're basically within a box bound by legislation. And some of the issues that were discussed earlier, as far as the ministry's ability to investigate and when is a worker and not a worker, part of the issue is we're bound by the legislation. So I've put up the definition of worker, and there's a couple of key things here. So there's a number of things that have to be in place for someone to be considered a worker. So the first one is they have to be in the course of performing work or supplying services. And now there's exceptions in numbers 2, 3, and 4. So somebody who's a student on a placement doesn't have to be paid, but they have protections of the Act. Number 5 says somebody, where it's prescribed, that means in a regulation. I'm not aware of any prescriptions and regulations that provide exemptions. So the key is somebody is performing work or supplying a service and monetary compensation. So those two things have to happen. And some of the issues when somebody hasn't gone all the way to the workplace, we can't necessarily assert our jurisdiction with the employer. As well, if somebody's in isolation, although they may be getting monetary compensation, they're not in the act of performing work or supplying a service. So from a legislative standpoint, we don't have the ability to use the Occupational Health and Safety Act to investigate those sorts of situations. Very similar, somebody can be getting paid in another context for, somebody's receiving WSIB, we're not considering them to be a worker because they're not performing a service, but they're receiving monetary compensation. So then the other key thing is there needs to be a workplace, and what is the workplace? And it's clear, anywhere where a worker works is a workplace. There's one small exception, and that's the definition. This is really providing exemption to a personal residence. So even if someone's working in a personal residence, we don't have jurisdiction there. And if they're not working in a personal residence, we absolutely do not have jurisdiction and can't assert our jurisdiction. So to make it relevant to this conversation, bunkhouses, we consider them to be a private residence because people, they may be getting paid, but they're not performing work in the bunkhouse. That would be akin to their private residence. So these are some of the jurisdictional restrictions I think that you're going to likely want to ask some questions about, or sort of engage in a conversation. But that's how the ministry applies the legislation to these particular sets of facts, so to speak. And I just want to talk very briefly about our role at an inquest. So, and thanks very much, Reuben, for all of the great information that you've shared. Part of the challenge with conducting inquests in an expedient fashion is the fact that many inquests are in sectors where we will be doing fatality investigations that often lead to charges, and the inquest is not performed until the appeal period has run out at the sort of the end point of the legal process. So sometimes it's pretty quick if we're going to charge somebody. because there's violations of the act and or regulations. Somebody could plead guilty quite early in the process, and we then provide all of our information to the coroner, and the inquest proceeds. There are cases, however, that can go all the way to the Supreme Court, and that can hold things up for years. And unfortunately, the family then doesn't get the inquest until sometime after the legal process has concluded. As far as our role at the inquest, oftentimes our investigations are provided, well, every time our investigation is provided to the coroner to assist in coming up with the coroner's brief. We certainly provide our inspectors, our experts, such as engineers who were involved in the investigation, to provide evidence if it's suggested from the coroner or the parties that would be helpful. And we will often have standing, not always, but most times we'll have standing, which allows a representative from the ministry to ask questions and not just have our folks come and provide information. And then, being the Ministry of Labor Training and Skills Development, quite often jury's recommendations are directed towards our ministry. And we also will, right within my unit, I have a specialist who takes care of that. We coordinate the response, talk to the appropriate section of the MLTSD, and we sort of coordinate the response that goes back through after going through approvals to the coroner's office. So that's a very brief overview of some of the legislative points, and I'll be happy to take questions at the end of the process. But at this point, I'm very happy to have Ileana talk to you about some of the forward-thinking things that we're doing in the vulnerable sector. Thank you.
Good afternoon, everybody. Thank you for the invitation to speak at today's workshop on this day of mourning. I'd just like to introduce myself. My name is Ileana Rates, and I'm the Vulnerable Worker Specialist, as John mentioned, with the Cross Program and Strategy Support Unit. I work out of the Occupational Health and Safety branch, and I am a part of the ministry. So I wanted to talk a little bit about what workers facing vulnerability looks like, and a little bit about what my role looks like in that capacity. And so vulnerable workers are definitely workers that I focus on, and that we consider workers who are exposed to conditions that can likely lead to illness, injury, or fatalities unless adequate controls are in place. Vulnerable workers also have a greater risk of having their rights exploited and of being killed or injured on the job. So some of the groups that I focus on specifically are temporary foreign workers, new and young workers, immigrants, refugees and newcomers, Indigenous workers, and the list goes on, among many others. And something that is always evolving is, the current climate and social issues internationally, nationally. And so as those things change and are evolving, vulnerabilities change as well. And accordingly, my areas of focus adapt. And so currently there are 3 areas that I've been turning my attention to. And the first one would be Ukrainian refugees. And so obviously due to the war in Ukraine, we're seeing a greater volume of Ukrainian refugees coming to Canada and Ontario and joining our workforce. So we've initiated the translation of occupational health and safety and employment standards materials into Ukrainian to provide the required employment-related information to this new group of refugees as they begin to enter our workforce. And once that's completed, we'll share this with all our stakeholders for distribution, whether that's settlement agencies or Ukrainian consulate or Congress or different community groups. But we've been acting as a hub for information sharing. We've been answering questions on specific employment-related issues, and we're going to continue to collaborate to see how we're able to continue to provide these supports going forward. The second more current issue is that of the expanded temporary foreign worker program, and the last one is that of human trafficking and our ministry's new Divisional intelligence unit. And I'll get into both of those in the next slide in greater detail. So when we talk about the expanded temporary foreign worker program, what I'm referring to is that the federal government announced the expansion of the temporary foreign worker program on April 4th of 2022. The sense was to address some of the current job vacancy issues across many sectors and occupations. And so what became most pertinent, I guess, to our branch was one of the items listed by the federal government, and that was the fact that now there would be 7 sectors which would be able to hire 30% of their workforce through temporary foreign workers. And that is an increase from the previous 10%. So it's quite a jump for that 20%. And those 7 sectors are food, wood, and furniture manufacturing, accommodation and food services, construction, hospitals, nursing, and residential care facilities. And then all other low-wage categories or sectors are now able to hire 20% of their workforce with temporary foreign workers, also again, an increase from the previous 10%. So these changes mean obviously an increase in the amount of temporary foreign workers in our province. And, this is something that's historically been filled with foreign agricultural workers and a smaller percentage, I guess, with household services, gas stations, or accommodations. But now we'll see a larger number through all of the above noted sectors. And then when we look at workplace vulnerability, what does that mean? And what does that mean for those 7 sectors, for example, or just an increase of temporary foreign workers? And I think part of the issue is that when workers come into this country and they're tied to an employer, it can limit their ability to voice any concerns they might have regarding unfair labor practices or health issues, for example. And for temporary foreign workers, then their accommodation, their livelihood, and their permission to stay in Canada could potentially be at the mercy of their employer, which creates a dangerous power dynamic. So because of this, we've created a preparedness plan to coordinate and collaborate with relevant stakeholders and begin to provide supports to the relevant sectors from both a vulnerable worker lens and a small business lens, so that small businesses are having the supports necessary to provide the information to workers coming in as well. And so now to move to the next topic, human trafficking. And human trafficking is on the rise globally, within Canada, and provincially for sure. And so our ministry has created a divisional intelligence unit. This unit was approved in 2021, and staff began to be onboarded as of February of this year. And part of this divisional intelligence unit was created as part of the provincial anti-human trafficking efforts that exist across many ministries. And so this unit is comprised of health and safety inspectors, employment standards officers, and a senior manager of the unit. And I also support in my capacity as vulnerable worker specialist as well. And so what the unit is focusing on is investigating exploitative labor practices and labor trafficking activity. And so they asked if anybody has any leads with regard to this, that these be sent to the email address that has now gone live and has already started receiving tips and leads, and that's labortrafficking@ontario.ca. I've included it on this page. And one of the things to note for that email address is that affected workers do not need to be identified. And that becomes an issue when people have precarious immigration status, for example, and they don't want to necessarily have to identify themselves, but they would potentially want to, want the ministry to be aware of the fact of some kind of labor exploitation that was happening. So this can be provided anonymously, and these leads go straight to the unit, and then the unit investigates that further. So for any questions with regard to that unit specifically, the senior manager is Patrick Long, and I've included his email address and his phone number, and those types of questions can be directed to him. And if there's anything more so with regard to the workplace vulnerability piece of this, again, I've included my name, my email address, and my phone number as well on this slide. So I wanted to finish off just talking about a little bit of the action that we're taking as a ministry, and specifically in my portfolio, for example. So we have a workplace vulnerability working group, and I'm the chair of this working group, and I work with two of my co-chairs, which is Eduardo Huseca from OCAL, which most of you must be familiar with, and Basha Kinar from IWH. And the three of us work together quite closely, and we're always considering how vulnerabilities present themselves geographically and in different employment sectors, and how we can assist. And we collaborate with the multiple stakeholders who are also in our working group. Most recently, we created a vulnerable worker lens document that we'll be using to provide a supplementary review of different occupational health and safety program concepts that will be coming up in the coming months. And with regard to human trafficking, just wanted to outline a few numbers. So it brings the whole divisional intelligence unit into more of a context. So we've received over 50 tips related to suspected labor trafficking. And although the unit was onboarded in February, the actual email address didn't go live until probably a month after, when they were ready for everything logistically. And so, in quite a short time, they've already received 50 tips, which is, what they were hoping for. 21 referrals have been made, 13 active divisional intelligence unit investigations have taken place, and over 35 awareness presentations have been delivered just about the fact that the DIU exists now, and just to make people aware of that. And I assist with that a little bit with the stakeholders that I work with, just to make them aware that now the Ministry of Labor is involved, and we have our own unit which is looking into these types of labor trafficking and labor exploitation activities. And the last thing that I'd like to report on is our temporary help agency initiative. The ministry will be providing occupational health and safety compliance assistance to workplaces from May, starting next week, till the end of August. And then we will have focused inspections and the enforcement phase of the initiative taking place from the end of June to the end of August. And in the 2021 Temporary Help Agency Initiative, some of the results and some of the numbers that came from that was that there was 323 field visits, 310 workplaces visited, and 691 orders issued. If we're going to talk about specifically to agricultural and farming sectors, it's 53 field visits, 53 workplaces visited, and 49 orders issued. So I'd just like to, I've included here on the second last page just some resources if anybody wants some more information about into a few things that I've discussed today. There's some more information listed there. And I've concluded with the last slide, just providing my name, email address, my phone number, so that if anybody wants to get in touch with me, or if anybody wants to discuss anything that they think is important for the ministry to get involved in, please do reach out to me. I'm always happy and open to discuss. And I'd just like to thank you for inviting me to present today at this important workshop. And now I'll pass it over to you, Bill.
Thank you. It's interesting because listening along, one thing that we've often run into, and we actually, I saw Eduardo is on the call today from OCAL. We actually went down to Simcoe, Ontario on a Sunday at night and bought pizza and pop and tried to bring some of the workers on their one day in the town to shop in to have a discussion with them. And none of them felt that they were vulnerable. And so I think that that's something important for us to remember, no, I'm strong, I'm proud, I'm here, I'm working, I'm making a good wage. I'm not actually, in fact, vulnerable. So I often wonder about that. And I know, Ileana, you are the vulnerable worker specialist, right? And so that focus can be so cross-cutting on how individuals are actually vulnerable. It could be their age, it could be the language they speak or don't speak. And so it's just something to remember, I think, as we think about prevention, because we want to provide messaging in a way that individuals recognize. Carlos, I see you have your hand up. Please feel free to ask questions. I think we're kind of at the Q&A period. I don't have anything specifically to talk to, but I will talk about certainly how prevention is now more involved with inquests and the recommendations.
I'm sorry, it was a mistake, the hand.
Oh, different hand, wrong hand. Okay, no problem. So yeah, and so the second thing that struck me was before the Metron accident, which was December of 2009. It was Christmas Eve. It's so long ago, but it's fresh in my mind because we finally had the inquest for it. And listening to the doctor today talk about the inquests and the reasons for them, um, it's interesting that when prevention was existed as part of the Workplace Safety Insurance Board, I don't think I remember them ever having standing or receiving, explicit prevention-based recommendations. So it's exciting to see that we're now present as a system right across the board. We have the enforcement and compliance support side, we have a policy side, we have the prevention side, trying to work together in a more effective way. OCAL, thank you very much, Val, and to your team for putting this on today. OCAL is just an absolute champion when it comes to health and safety and reaching populations such as the migrant workers and agricultural workers that a lot of our health and safety associations maybe don't have that same reach. And I think that, the more that we're able to work together as a system and try and leverage the relationships that we've made with other government and with like the public health agencies, the better we'll be able to support. It is tough getting caught within legislation. John was talking about that if you're in your dorm, you're in your you're in your home, and we can't go there. And that mandate crosses over and becomes something that a municipality would do. And so I know that certainly I've heard that sorry, not OCAL, OMAFRA, so the government, the ministry looking after food, agriculture, has recently developed a brand new team that is now looking more from a worker lens relating to agriculture. So not only COVID and the unfortunate deaths, and today is the day of mourning, our occupational fatalities, went up by close to 36 or so percent. And that was as a result of COVID and individuals that passed away from that as an occupational disease. So, it's had an effect everywhere, and it's good to see government is reacting. I know I saw Heather's comment saying that, why isn't government listening? We are, absolutely we are. We're doing a review of the occupational illness system, trying to ensure that people are not missed, and that when there are recommendations and reports such as the one we saw earlier today, we need that, right? We need to have that clear direction. We need to have that mandate. It really helps government to be specific and accountable. So, I think the main thing coming out of these recommendations now from the prevention standpoint is that we're starting to see, very direct, very focused recommendations from these juries to help guide our work moving forward. I'm excited to say that our new chief prevention officer, so my boss, he's an appointed chief prevention officer, but he's also an assistant deputy minister, Dr. Joel Moody. He's a medical physician. He's done a PhD in epidemiology. He's a civil engineer. He's very learned, and he is just absolutely adamant that we need to get down to data. And so that's to your point, Heather, and I saw the comment back from OCAL. The more data and information that we have and science that we recognize, the better it will be for us to do prevention. So, whether it's occupational exposures in nature to things such as pesticides or to, solar radiation, right? Those are within, the sun, and getting melanomas from the sun is in the top 4 carcinogens in Ontario, one of the 4 biggest burdens as it relates to cancer. And, and we want to make sure that individuals are not getting exposed beyond limits that they need to be. And so doing the surveillance, understanding what's happening in the workplace, and then moving to not only their other government, but our partners, to where they're housed, the working conditions, how they travel to and from the farms. Like there's a lot that we can work on. So yeah, we're here. We're absolutely listening. Very dedicated to this. It's, for me, it's exciting to see those numbers increasing, the number of temporary foreign workers within those 7 different jurisdictions. I think that's great news. I think that's exciting news. Certainly, we keep identifying that there is a shortage of labor. And so we need skilled workers to come in and work in those industries and I support that absolutely. So our big challenge now is to ensure that they are not left behind in any way, shape, or form. So it puts them at greater risk, obviously. Maybe that's Carlos's real hand. Go
Yeah,
ahead.
now this is intentional. One very brief question. What is your stand on the open work permit for the workers? I mean, for the province. I mean, more people, we need workers. They are going to be coming. What is the stand of the government on this subject?
On open work permits, Bill, that was the question, whether there's any, I'm not sure if the provincial government has a perspective, if it's.
Yeah, I honestly, sadly, I don't have a perspective on that. Maybe is that something that we consider over on the operations side, Ileana or John?
Yeah, the reason I'm asking, I know that the province does not have a direct authority on this, but there are other ways in which the province can help to improve the living conditions of the workers, such as bringing their families with them or trying to make it easier for them to profit out of the parent insurance, like the thermal insurance, stuff like this. There are. And once again, I will encourage you as a representative of the province to reach out to the countries of origin, because when the workers go back home, they carry a lot of the problems, and they have to get treatment over there. And sometimes because of the timing going there and coming back, they lose the right to be treated, or they have to go back again into the system when they come back the next year, if they are allowed to come back. So there is a big field of opportunity there for the province to engage and to ensure that they have better conditions. And of course, the big problem is the housing. The ventilation has to improve. At least, I mean, that's the least of the things, but I mean, COVID and the different variants are going to be there for a few more months, years probably. And the last thing that we want is outbreaks again, right? So yeah, that's my contribution.
Thanks a lot, Carlos. Actually, that's part of our migrant farm worker project this summer is about improving air cleaning by use of do-it-yourself air cleaners, trying to disseminate the knowledge about those for use in bunkhouses. But and thanks for your comments. I'm not sure. We have Steph and Michelle who each had a question, and I know Heather, you made some comments. I don't know if you want to, and I don't know if the ministry can comment on the challenges around COVID and the sort of where the regulations come from and that kind of thing in terms of COVID, because it's a bit complex with the involvement of the Ministry of Health as the lead ministry. But I don't want to just and John's can only stay till 3 o'clock. So if anyone has a question that's specific to enforcement, maybe we should have those first. If anyone who's got their hand up, or otherwise, if you have a question about enforcement.
Michelle, are you going to ask about enforcement?
Michelle, are you muted?
Sorry about that. It's related to enforcement. So should I just ask Steph? Go ahead.
Yeah, mine's
Yeah,
not.
okay, all right. So one thing I wanted to thank John for explaining the clarification in terms of under the Act, who is a worker and who is not a worker. So I want to thank him for explaining the black and white issues around that. But my next comment may be directed to both John and to Bill. Very specific to this population, how can these workers be identified as workers? I'm calling them workers. WSIB recognizes that they're workers from the minute that they land. So how can these workers be included in the Act and be identified as workers?
Well, thanks very much for the question, Michelle. Maybe I'll make the first comments. The definition in the legislation requires legislative amendment in order to change it. So what I would suggest is the only way we can really change the Act and how we apply the Act is to actually get legislative change. So it would require the government to change the definition within the Act. And there's many, like obviously this definition applies universally across the province to all provincially regulated workers. And I realize that that's a real stumbling block in this particular area, but as I've said, we operate inside of a box that's bound by legislation on all sides. So for us to be able to have jurisdiction over these workers in these sorts of circumstances, it would definitely require legislative change.
Thanks, John. I appreciate that. Bill, in terms of prevention, do you have a path forward that you can see?
Yeah, so as you heard, we regularly are working with our health and safety associations and with the enforcement folks. It's unfortunate that it's not specifically recognized in the Act. However, we feel that we can go outside the Act. We talk about work-related mental health, right? Which is not, there are no psychosocial hazards cited in the Occupational Health and Safety Act or any of the regulations. And so there's certainly areas where we are lobbying to have change, lobbying to make sure that workers are informed. A lot of the time, materials and products are being made and they try to disseminate them, but they're not in languages that folks understand. They're not translated, right? And so that's when we rely heavily on our friends at OCAL. Also, the WSPS does work in the agricultural sector. That's Workplace Safety Prevention Services. Those are really our partners that have either networks of volunteers that are able to go out to the actual farms to get onto the property itself, or we're able to fund to provide that outreach to those individuals. As far as changing the legislation, that's, I think that the reports such as the one we saw earlier today will really help with that. I think that moving to have inquests relating to agricultural workers certainly will help to reinforce that as well. Identify the gap and provide that recommendation and direction to government. Do we have an explicit plan right now for this population? Unfortunately, no, not to move them towards recognition as workers. We're, again, it's that trouble of the law.
Okay, thanks for that response, Bill.
Okay, I guess we have Steph and Hannah and Heather up next.
Sure, and mine is, I just wanted to sort of speak back a little bit to something that Bill mentioned when he visited the metropolitan town of Simcoe on a busy off night for workers. And you mentioned that workers didn't explicitly self-identify as vulnerable. And so I just wanted to draw attention to two different aspects of that. Workers may not completely have the same understanding of vulnerable in terms of a systemic vulnerability. which certainly they feel at risk. And we know very much that workers suffer poor health outcomes that are directly related to the social determinants of health, which completely emerge from the structural conditions of their employment here. And many workers are very hesitant to report any feelings of being at risk or feeling vulnerable to those risks in the context of not knowing who's asking, what the purpose of the question is, and for fear of being identified as potentially making a complaint against their employer. And this creates, or this speaks to the climate of fear that workers live under here in reporting any condition that puts their life or health at jeopardy, because they are tied to an employer for the year. And this speaks to Carlos's point earlier about the nature of the closed work permits that temporary foreign workers are on here, makes it such that they are exploitable and deportable. And those structural conditions underlie all of their experiences here, and they inform their willingness or lack of willingness to be honest about their fears and concerns, because they may not be hired back if they are perceived as complaining. So I just wanted to sort of set that context there for you, because in the last 8 years of doing research in Simcoe, most certainly that area has some of the most vulnerable workers. But these workers are medically screened before they come here. So they understand themselves to be strong and capable of labor, right? Whilst they're laboring under risky environments. So I just wanted to sort of speak to that. I'm glad that you were able to go into Simcoe and see some of these things firsthand.
Oh, absolutely. Thank you. Thank you very much, Steph. And yeah, but I wasn't, hopefully I didn't come across as saying that they're not vulnerable. We certainly recognize that. It's how, we have to find ways to communicate where you're right. It is triggering for them to want to speak, that they feel safe and encouraged to do so. So thank you very much for that. Yeah, and thank you for the continued research. Yeah, it's extremely important.
Thanks. So Michelle, your hand is still up, but I asked you a question, right?
Yep, I'm sorry, it's a stale hand. I'll take it down.
Hannah, how about you? Do you have a question still? And I don't know, Hannah, so maybe Heather, you can go, because you have put some things in the chat. And I don't know if you have
Sorry,
any.
I was muted. Can I just try my question?
Yeah, go ahead, and then we'll have Heather next.
So thank you, Stephanie, for sort of speaking to the legal vulnerability of these workers to health and safety violations. So my question is like, when you see an increase to 30% in certain sectors and a doubling of certain sectors of temporary foreign worker programs, when you're talking about enforcement and prevention, then do you look at your budgets and go, oh, we're going to need to have more money in order to sort of deliver the same type of activities, given the fact that we're increasing, like a substantial increase in the amount of workers we know are subject to a high risk of harm in their workplace? How much more is this going to cost the province?
That's a good question. Bill, have you got any answers?
Well, I think so. An important thing to recognize is that it is actually premiums paid by employers that funds the health and safety portion of the budget so it's not actually taxpayer dollars per se through the Treasury Board. So it's almost like a system of of circular return, right? That if things are really bad in the province, premiums are going up. They're increased. They're increasing the amount of money which they're collecting to pay for a larger amount of injuries, but also to increase the enforcement and prevention of occupational illness, injuries, and disease, fatality in the province. And so, it's almost cyclical in the fact that this is right now we have the highest amount of enforcement officers out in the field that we ever have. It's over 500 individuals. And as we shift out of COVID and they have more and more time to be proactive, these are the areas that we are in fact focusing on is finding these vulnerable workers, finding the vulnerable populations, because that's where the injuries and illnesses are happening. And so, the cost itself, we've had a flat budget. It's for the prevention side, it's about 115 million. It's about 280 million or so, give or take, for the health and safety side. That may have gone up as a result of the increased inspectors. So there's a significant amount of money going out there currently. You know, ultimately, we did have an audit on the system, and it was couched in the fact, although Ontario is one of the safest jurisdictions to work in North America, there's more that we can do, right? We have to understand what kind of impact that we're having with the investments that we're making. And so, these are areas where, we will have that specific focus. And I think if there is a need for an increase in funding, there's rationale for that. And it's not coming out of individuals' pockets, it's coming out of the employers' pockets that have these bad records and are paying the higher premiums.
Thank you.
If I can just add, Bill, from an operational perspective, definitely what we've done, we found out about this not very long ago, but we have the ability to plan our initiatives. I mentioned that we've increased our inspectorate by 100 during the pandemic. Some of that work is starting to tail off a little bit, and definitely we're prioritizing these areas. We've reached out to a number of employer associations to make them aware. As Ileana's explained, we're in the process of doing a system evaluation and determining what we need to provide, not only to the vulnerable workers that are going to be going in these sectors, but to the employers that are going to be hiring these vulnerable workers. And what I can say is there's great discussion and sharing across prevention and operations. We had some discussions with Bill about translating certain key training into other languages, and I can't say how accommodating Bill was. We're looking at construction, so obviously working at heights, trying to, we're reaching out to the federal departments to find out where are these people, what's the country of origin, so we can determine what languages we need to change what programs into, and address the killer contraventions in the sectors that these folks are going to be going to. So those are some of the things that we've started doing as a ministry to get prepared so that we can protect these workers that have vulnerabilities when they come. And I'd just like to say thanks very much for having me. Unfortunately, I do have a meeting I'm a bit late for that I have to go to right now, but happy if there's any questions, Val, please reach out to me. I'd be very happy to provide any additional answers. And thanks very much, everyone.
Yeah, thank you, John.
Yeah, and I'd just like to add as well, for our workplace vulnerability working group, that's something, as I said, that this came out with the federal government on April 4th. So it's the first thing on our agenda to address, and our first step will be to, in due course, quite soon, we're hoping, to collect, to get together stakeholders from any kind of, for federal government, provincial government counterparts, other different ministries, community organizations, grassroots volunteers, just getting together everybody and really breaking this down to what this expanded program means to workplace vulnerability, and trying to get together and for it to be a brainstorming session for everybody to meet to discuss this. And from that, we are going to be having an action plan of what we're doing going forward in order to provide additional supports if necessary, if it needs to be an initiative, if it needs to be training to inspectors, whatever it might come of that forum. But it's definitely, a priority for the Workplace Vulnerability Working Group, and it's something that's noted, and it's a huge change. 100% we agree, and we noticed that, and it's something that just came out a few weeks ago. So we're definitely, our intention is to be very responsive and very quickly.
Thanks a lot, Ileana. Okay, Heather, did you want to sort of frame your question or just articulate it a bit more than?
Okay, thank you. Thanks everybody for doing this. It's an old interest of mine. I've been much more involved with basic income since we moved to Quebec. And my experience with Bill, for one, and a few other people, but not people I know on the call necessarily, was with the Occupational and Environmental Health Coalition in Peterborough, with which I was central with many others for 13, 14 years until 2018. And so my question is always political because, you know, any change requires political change. Somebody's smiling there. And I know that Bill and John can't answer all these questions, and maybe, is it Ilsa? I forget your name. Ilana? I'm not sure you can. But I see that this is the problem. It's not lack of knowledge. We all know about, not all, but you know, there are enough of us who know about the social determinants of health, et cetera, et cetera. But I have to say, when I heard that presentation about from the migrant workers, the research paper that was presented off the top here, it just pushed my social justice button. So I'm not going to ask any questions. I just wanted to air that, okay? And we need political activists who know what you good people are doing, and you need them outside the government, right? And we need to work together across party lines because it's about human beings. It's not about allegiance to a party. So that's what I think has to happen, and I'm always happy to help anybody who wants to work that way.
Thanks.
Thank you.
Thanks. I guess I'm trying to see if there's some other, first of all, I guess, can the speakers stay another few minutes? We've got Carlos and Eduardo, and I think maybe there's just a couple of comments in the chat. I haven't seen anything else, but I would like to recognize those. So can you stay another few minutes for Carlos, Eduardo, and then we can just look at these and then hopefully finish up by 3:20 or 3:30 at the absolute latest?
Yes, 3:30 is fine. Yep.
Okay. Okay, so you're okay too? And Ruben, thanks, because I think the a lot of these questions, because it's the last talk, a lot of the questions are Ministry of Labor focused, but I think the two different lenses and the broader lens from the coroner's office, I think, and its abilities and, to study things and then how that informs back and forth in terms of worker protection, I think that's it's essential of today's discussion, and I think it is really important for us to all know and understand and keep up the dialogue. So so Carlos, so you had a question?
Yeah, comment. I forgot before about the workers referring that they are okay, that everything is cool. You just have to keep in mind that they are in a, I'm gonna say a hostile environment, but a different environment. And any person, white person that talks to them may be an informant, or they don't want to be unpolite. That's a cultural thing also. And there is a concept of manliness. Being a man, you cannot acknowledge that you are sick or there are problems or somebody is abusing you. I mean, if you have been on vacation in a different country, try to imagine when you're trying to go back to your hotel in the night, I mean, if you want to speak the language of the place, you may feel threatened, right? So that's the state in which they are all the time. About the 500 inspectors, if you want to do something to improve, if the province wants to do something, start with unannounced visits. The consulates have to get an appointment to visit the farm. And that's just silly, right? I mean, there are a lot of cases in which we have been receiving reports in which employees, workers are told to clean, to put everything in order because consulate is coming the day after. And then the foreman is there when the officials are talking to them. So unannounced visits, that would be great. And that's going to be an opportunity. It's not the best, but that's something that I think the province can do. So that's it. Thank you.
That's a great point, Carlos. One of the things that our inspectors have under the Act, one of the powers is to enter without warning. But they can also bring individuals with them that are relevant to the inspection they're about to do. So that's certainly something that we can explore to figure out how do we, in fact, get the consulate to go in partnership with the ministry. So
well,
we can walk them in and they don't need the notice.
If you allow me, the consular officials are, I mean, they are on the treaty, they are allowed to visit, even without the province, right? So they don't really need the province. I mean, if there is a claim, there is a problem, they may just show up and just sit there in the nationals, right? Which, I mean, this is another fact, another situation, because in international law, they are supposed to be there to take care of their nationals, and they are not being effectively able to do so, which is an infringement in international law. So it will be great if they are allowed to just drop by, obviously with certain measures of security for them and for everybody, but that would be great, I think, because that will bring more light into the industry.
Once again, that circles back to the complexity of all the layers of government, even within Canada, federal, provincial, multiple ministries, provincially, public health in 34 different regions, and international governments as well. So a lot of, I think, as I understand it, the pandemic did spur a lot more multi-jurisdictional dialogue, and I think we need to keep that going and in a joint problem-solving way in some of the ideas like Carlos just raised.
Yeah, I just wanted to mention to you, Carlos, that we do have quite open communication with the consulates. Like it's rare for me to receive information from consulates, get an email advising of something that's happening that we should be made aware of. We are in quite constant communication with a lot of the consulates, especially now, the Ukrainian consulates, the Congress. That is something that's already happening, and especially in our human trafficking space, we're finding a lot of the emails that are coming in are from consulates, or the phone calls that are coming in have to do with that labor trafficking information. So it is an open, ongoing dialogue that we do have with them. It's not that it's non-existent. I understand, your point to that should be something that should be even explored even on a greater level, but it's something that does exist and we definitely are doing.
And if you allow me, it's something that it really, really requires more effort, because in many cases, the workers communicate not directly with officials, but with organizations that are providing assistance. I have done that job of calling the consulates of different countries and asking them, and I have found myself, and the officials tells me, okay, we're going to program, we're going to call somebody to get an appointment to go. At the moment, when they finally make it to the farm, the problem has been eliminated.
Okay, I think that's an age-old problem with the Ministry of Labor as well, right? Surprise inspections versus communicating in advance. Because theoretically, if they fix things up, maybe it does improve the health and safety without the visit, but maybe it's just cosmetic, right? So it is. So Eduardo's next, and I think I saw Steph hand go up, and then we will. I would like sort of last comments too from each of the speakers. So Eduardo.
Great, and thank you so much. Sorry, my camera is not working, but it's nice to see you all, and thank you so much for all of the presentations, and the discussion's been so great. So I work for OCAL as well, and I had the pleasure to work with Ileana on the workplace vulnerability committee. So I just wanted to say, and I think I totally know what you mean, Bill, in terms of the reference to that, the experience of speaking to workers and around kind of the idea of them self-identifying as vulnerable. And I think that Stephanie and Carlos did a great job at contextualizing that in terms of, the pride of their work and even cultural understandings. But I kind of support that analysis too in some recent findings that we have identified out of an OMAFRA funded project that we just concluded that looked at trying to identify stressors, mental health and psychosocial stressors among migrant agricultural workers. We definitely, in terms of the findings, identified a significant fear or worry about becoming ill, injured, or disabled among the workers that we interviewed. So I do get it's a clear sense, and we've had that sense for years now, but in this project, we interviewed 26 workers, which is not a huge amount, but definitely, you could get a sense that whether we call it vulnerability or but this worry that, or this kind of understanding that they're in a situation and they're worried about getting ill, injured, or disabled because of factors that they're identifying and experiencing, and worrying that if that happens, what's going to happen to them? Are things in place structurally in the province to help them through those experiences? And so that, I think, is something. And in this data, we also identified kind of opportunities that or gaps, I guess, in prevention opportunities. So we interviewed 7 community health centers that are really leading the provision of primary healthcare to these communities. So these are really specialized services, primary healthcare services that are, out of the province, are the ones that have translators, are the ones that have outreach workers that go into the community to try to really connect workers to healthcare services. And when we asked what was the #1 health issue that workers presented with, musculoskeletal issues were #1 across all of the community health centers that we interviewed. And most spoke about this being work related and things like repetitive strain injuries and strains and pulls. Yet most of them noted that there was no follow-up in terms of WSIB or connection to WSIB because of, again, this fear of workers reporting and what would happen. And also just in terms of a lack of really being able to help workers through that process, right? And who really is in place to help workers through a WSIB process, even if they choose that they want to go through it. So I think that's kind of a big thing in terms of looking at musculoskeletal issues and prevention and how that, primary healthcare findings actually translate to getting onto farms and figuring out, how we could then prevent this. Because a lot of the community health centers then noted that it's a cycle, right? They can help people with these strains and pulls, but they go back to the work and they can come back with the same issues, right? So I think that's kind of something that we need to kind of fill a loop in and figure out. And I also was going to say, in terms of the discussion around the expansion of the temporary foreign worker program and more workers coming into these new areas, I definitely echo with Ileana that we're, as part of the committee, we're ready to go in terms of, working hard to prepare ourselves, but it is concerning. Like, I would echo that it is concerning because even OCOW, and I really, I'm grateful to be recognized, OCOW to be recognized as you mentioned, Bill, our capability of reaching workers that maybe the other, other system partners aren't. But even as connected as we are not connected to a lot of workers in terms of temporary foreign workers. So even in agriculture, our experience has been mostly in field workers, and we've been not very connected to mushroom production sites, greenhouses, less connected. And now with the expansion, we did a project where we connected to a few workers in manufacturing, temporary foreign workers in kind of agro-related packing houses, but we have little idea into the actual happenings in some of these workplaces. So it's concerning that even a program like ours that is very small, but I guess connected in comparison to others, there's still so much that we're not doing. And a clear example of that is, again, in this OMAFRA project, we produced some resources, posters with a bunch of resources that we felt were really important to get to workers. And again, we leveraged a lot of our community contacts that themselves would identify them as really well connected to the community. And when we did feedback on the posters, we really recognized that, they didn't reach a lot of workers. And so again, it's just echoing that even in the system, the organizations like ours that are more connected are still not reaching workers, and we still need to figure that out. So I think as a system strategy, there needs to be, and that's, I guess, what we're going to work on with Ileana, but how to get information to workers so it doesn't stay on websites, and when materials and resources are produced, they actually get to workers and all of that. And just an overall empowerment strategy for temporary foreign workers in the province. And I think, like, we started, and sorry, I'm almost done, but I think we really tried to leverage legal clinics, right? And figuring out, because we've identified, and a lot of people have, in terms of, for example, WSIB or anti-reprisal situations, right? We know that there's so many work-related illnesses and injuries, and we know that there's been reprisal cases, but who's really in place to help temporary foreign workers really navigate those situations? And I would say there's not. A lot of them fall through the cracks. And a few cases, like an anti-reprisal case that actually was well documented, was helped or was pushed forward by a legal clinic, but that was an exception. Like, that took a lot of resources around that worker. So we've been trying to talk to legal clinics, but it's very unclear. They're strapped for resources. Not all legal clinics in each community look at occupational health or work-related law. So in terms of the empowerment piece, there's a lot around that as well. So yeah, so a lot of work to do. But it is a little bit concerning, I think, for at least in my work area, to know that there's more temporary foreign workers, just recognizing that we're not necessarily, resolved concerns with sectors that we're becoming more aware of here already. Thank you, though.
Thank you, Eduardo. Does anybody have any response?
Yeah, you know, go ahead. I was gonna just sorry, Steph. I was just gonna say, you know, not only do I hear you, but I totally support you, and you know, but that's what we keep talking about is we have significant gaps in government of who we're able to reach, and you know, the more that we spend on identifying, or the, you know, the more time that we spend on identifying how we get that reach, the better off we'll be. um, I think we often talk to those that are already heavily invested in health and safety, or at least are on the start of that journey when we do our consultations, and we're not hearing from you know, small business. We're not hearing from these vulnerable populations, and we're certainly changing the way that we consult to not only be more diverse, but also try to reach those that are here in the province but are marginalized as far as the support that they're receiving from us.
Thanks. Steph, you want to add something?
I just wanted to briefly speak to engagement with sending country officials, because I understand that that's seen as, you know, as an ally from the province's perspective in terms of going into workplaces or receiving information from consular officials. And I just think it's also important to note that each country that sends workers through the program has a separate MOU with Canada. And each country that's invested has a different investment in this program. And that matters on the ground in the sense that some liaison officials from smaller countries rely much more on the GDP from their workforce and are much less proactive or helpful in helping their workers advocate for better working and living conditions. And in fact, play very instrumental roles in medically repatriating sick and ill workers before they're able to be entered into either the healthcare system or the workers' compensation system. So in thinking about sending country officials, and that is because for a variety of reasons, but each sending country official plays a different role to their workforce. And I think that's something to really keep in mind, because some of the smaller countries, and especially a country like Jamaica, who was the original in the SOP program, have very, very serious issues in their ability to execute their job for a variety of conflicting interests. And so thinking about community groups and advocacy groups are the best way to get information to workers and to get an accurate idea of what workers are experiencing on the ground, because it's sort of devoid from that power imbalance that structures workers' lives, also impacts sending country officials as well at a much higher level. So I just wanted to add that.
Another reality check. I guess it is complex, which is why, as I said before, that continuing to have this dialogue, I think, is really important every season, and particularly given this increase in temporary foreign worker percentages in so many more industries. I think it is going to be a challenge for all of us, just in terms of accessibility of knowledge, never mind the ability to support engagement and empowerment in a meaningful way, and internal responsibility system operating in workplaces, I think, is a major challenge. Michelle, you had one more. I was just about to do that. Okay, we have 4 minutes left. So if you want to have something brief, and then we'll ask each speaker if they have any final thoughts.
Sorry, there we go. Unmute again. Sorry. So you had mentioned about a final word from each person, and I have final words, and so I don't want to use up all the minutes. But I think part of the message is that information to workers is not enough. That there need to be resources and mechanisms for workers to be able to respond to the information that aren't in place right now. The solutions, there are lots of information on recommendations and solutions, and it needs to be acted upon. And last thing for the Ministry of Labor, Eduardo has already mentioned about musculoskeletal injuries, and we have gone around this for almost 2 decades. I have never seen a Ministry of Labor inspection that addressed musculoskeletal injuries in this population that I know of.
Thanks, Michelle. And I guess maybe that's a topic for another discussion then. How MSDs are tricky because there's no specific regulation about them that applies to any workplace, actually, right? So, but I know the ministry does do blitzes, which we don't call them, but which enforcement. Deb has pointed out that I missed her question. I'm having a hard time navigating between the hands and the chat. Deb, did you have one quick question you wanted to ask? Was it about the penalties besides fines? Criminality then gets into the criminal code. Was that the question?
Yeah, I apologize. I might have missed this, but I feel that if employers were, had more penalties aside from monetary, maybe there would be more of a focus on prevention.
Yeah, absolutely, Deb. I don't know if you got I sent it in that direct chat, but so there's legislation called Bill C-45 that was introduced. The case I spoke about, Metron, is there were in fact criminal charges as well. When a fatality occurs in the province, we certainly investigate that until the coroners determine that it is in fact work related. The police have lead on those investigations, and so they're checking first to see, looking for negligence, looking for signs of criminality. There also has been some suggestion, individuals have talked about creative sentencing. So it's not something that exists here in Ontario, but it's something that we've taken a look at, where rather than just a monetary penalty, they have to give back to the community, or they have to go and provide, training on their dime to, farms within 100 kilometers of their farm. So we've seen instances of that in Alberta, and so that is certainly something that our prevention council here has talked about, and that's an advisory body to the minister. So there are in fact there are in fact regular conversations. The problem is that really it takes something significant like a fatality, and we would love to apply RSIs. Over time, the crippling nature that disease can have is not unfortunately treated the same way as like a fatality, and so that's a conversation we need to have, right? It's continued conscious negligence that we unfortunately see in some sectors, and as you heard from John, that's certainly something that we try and focus on. We figure out best evidence of where that's happening, and not only with temporary foreign workers, but also temporary help agencies here in the province. It's happening to Ontarians as well.
Thanks. Okay, and thanks, Deb, for raising that. And yeah, the C-45 is based on the Westray mine, which the 30th anniversary of that disaster is approaching on May the 9th, actually. And I think we all hoped that the bill would raise the bar of enforcement and not raise the bar of the negative consequences, and therefore have positive influence on health and safety. But it's a tricky bar, so that's another topic for another day. But so let's have final comments so we can wrap up. And I think people have put their emails in the chat if anyone, or you can ask us questions and we can convey them to the speaker. So Michelle, did you have anything you wanted to add? And then Steph and Max.
No, is Ruben gone?
No, I'm here.
Okay.
Yep.
Yeah. So no, I think I'll leave it to the other speakers.
I was just going in order of the afternoon. So Steph and Max, did you have anything else you wanted to add as sort of final comments?
I'm not sure if Max is still here, but I would just like to say thank you for this opportunity to present the findings from our report, and just want to again highlight the preventable nature of these deaths and the need for a coroner's inquest going forward so that we can get a better understanding of what's going on here and prevent future deaths in this province. Thanks again.
Thanks, Steph. There's a segue over to you, Ruben, in terms of the request for an inquest, but what does that actually look like, even in the context of Bill's, that the Metron inquest only happened 10 years or more than 10 years right after the accident. So anyways, go ahead, Ruben. Do you have any last comments?
No, I think again, reiterating just the thanks for being able to participate and inform. Certainly feel free for anybody to reach out, and we can convey any information or data, and certainly I will reiterate and pass on the discussion points and the requests around an inquest. Again, it is a consideration in the office, so it is being discussed. So.
Okay, thanks very much.
Thank you.
Ileana, how about you?
Nothing. Actually, I just had a question about, are the PowerPoints is there an opportunity to send out the PowerPoints to other participants?
We usually post them on the website at the event posting with the video links. So those will be up on the website by today or later today, hopefully, at least by tomorrow morning. But although, Ruben, you need to send me yours, I think. But I may have missed it in my email. But we could send them out to everyone who's registered as well.
That's fine too, just as long as because it has the email addresses and also the email address for the human trafficking piece and our contact information, just so if anybody does want to reach out and then they close this chat box and can't get my email or don't remember my first name or last name.
Great. Okay. Thanks. Yeah. Good reminder. How about you, Bill? Last words?
I thank you for continuing to put these together, Val. It's such a critical conversation, given that the number of workers coming in will be increasing. It's of critical importance. And absolutely, I'm not Bill Roy in the email. It's william.h.roy. I put that in the chat, or Val will be able to connect me with you. Carlos, absolutely, I'm going to reach out. I think that there's some really good opportunities relating to the open versus closed permit, and we can talk about the housing. So always happy to have the conversation. Very passionate about worker safety and making sure everyone gets home. So thank you very much again for having us today to present, and cheers.
Yeah.
Yeah, and thank you everyone who participated, who presented, specifically for taking the time out of your busy work life to present and attend, and all of the participants for attending and hearing this very important information.
Yeah, I echo that too. Thanks, everybody. Time is such a premium nowadays, and on day of mourning, there's many things happening. Actually, I meant to paste those in the chat. There's still memorials around the province, and I do think it's important. So I really appreciate the speakers taking the time, and I do think, at least a yearly conversation about severe injury and OC disease. We didn't even get into the discussion of how do we investigate OC disease from this sort of more formal lens, and then of course how can we learn about all of this for prevention. So I think the dialogue and the discussion continuing is the best solution. So thanks again, and we'll invite you next year, and meanwhile everybody have a healthy and safe weekend, month, year, and all that. And of course I did put in our Workplace Mental Health series starts tomorrow morning. It's a busy week. It's not even 24 hours from now, because it's at 10 in the morning, and it is about addiction and opioid harm reduction at work. And there's an actual direct connection between injury, workplace injuries, chronic pain, and addiction to painkillers. And certainly that's because we're all about prevention, and injury prevention is the first way to prevent painkiller addiction, we think. So that will be part of the discussion tomorrow morning. So we hope people can join us there. So thanks very much. I will close off, and we'll see you next time. Thanks. Take care.
Thanks. Bye.
Bye-bye.
Thanks, Val.